Hello, welcome to Your Health. I'm Lisa Hart. Mental illnesses do not discriminate. They affect all ages, men, women, and children. Everyone is susceptible. Concerns are broadcasted by candidates running for office, famous actors and actresses, the World Health Organization, and others. Today I am joined by Mark Costa, who is the Senior Vice President and Area Manager for Kaiser Permanente, Orange County, and Dr. Eric Nguyen, who is the Physician Director of Behavioral Health, also with Kaiser Permanente. Welcome, thank you both for joining us today.
Good to be here.
That was a lot to say in one full swoop, but let's start with you, Mark. Tell me a little bit about yourself.
Well, I am an executive in healthcare. I have gratitude every day to be in a field where I can make a difference. I've been doing this for just under 40 years, wow. Both in Los Angeles and now here in Orange County. I'm father of 4, grandfather of 5, and so I've got a lot to feel fortunate about.
Absolutely, and you have been in the healthcare industry for a long time, so I am sure you have seen a lot of changes.
Yes, that's for sure, and we're certainly still in a period that needs us to change, right. To find new ways of better serving our communities and our residents.
Exactly, and Dr. Nguyen, tell me a little about you.
Thank you again, Lisa, for having us here today. My name, once again, is Dr. Eric Nguyen. I'm the actual Physician Director of Behavioral Health for Kaiser Permanente, Orange County. I oversee both psychiatry, addiction medicine, as well as social medicine. I'm a board-certified general adult psychiatrist.
Wow, and you've been in this industry a long time, too.
Yes, I'm actually in my 18th year with Kaiser Permanente and loving it.
Great, well, good, and we have some things to talk to you about, too, later. So, Mark, let's talk about Kaiser Permanente's model. We have various hospitals on, and there isn't one that's like yours. So why don't you give us a little bit of a background about why they became this particular model and what the model is.
Right. Kaiser Permanente, we've been in existence for over 70 years. We've been in existence here in Orange County for over 40 years, and it is a different model. It's based on the belief and the idea that we're here to take care of the whole person, in terms of the quality of their health, impact their quality of their life, and doing it through an integrated model. Really not focused on solely sick care, which is really what our hospitals in our community, and we have great ones here in Orange County, that we do such a good job, but to really have our physicians, our nurses, our system of care focused on meeting the personal needs of each and every individual and to do it in an integrated way.
Right.
We're a health plan, meaning we provide health insurance for both seniors through our Medicare Advantage, as well as Kaiser Permanente insurance. We provide pharmacy services, all organized in an integrated medical record, again with the goal of best serving our members.
And how do you find that to work well for you?
I can underscore the importance of the integrated piece of this healthcare delivery model because of the fact that as we start to take care of patients who age and grow older over time, the complexity of their medical care becomes so much more moving parts that require people to communicate well, share information, and without an integrated delivery model, you just simply can't do that.
Right.
And also, the other piece of it is that we are very, very focused on preventive medicine, which is very important if you look at the upstream effects of how do you prevent some of these illnesses from marching forward through time and presenting as a crisis later on in someone's life, you have to capture it upstream. Right. And that's where we do preventive medicine like no one else does, I feel.
That's awesome.
Yeah.
That's great. In terms of someone finding out about you and finding out about the model, where's the first step? What's the first step for them to do?
Well, there's a lot of different sources. If you're working and you're an employee, the majority of the employers in our area offer Kaiser Permanente,
okay.
So that's great. If you are a senior and elderly, we're a 5-star Medicare Advantage health plan. And so what that means is any day of the year, there's an option of joining Kaiser Permanente.
Okay.
And then we also provide health care to CalOptima patients here in the county. And so those would be the individuals that are vulnerable and are accessing healthcare through our state.
Okay, perfect. And let's talk about some of those accolades.
Yes. Well, we are proud in a lot of different ways. Our hospital care is some of the safest in the United States. U.S. World News identifies this as the best hospital. We have the 11th highest ranking pulmonary and lung program actually in the country. And then specialty services of geriatrics, our joint replacement programs, our stroke programs, and our behavioral health programs, all recognized, to doing a great job up front, but then when you are sick, to be able to meet your needs.
All right, excellent. All right, well, we're going to take a break right now, and when we come back, we'll talk a little bit more about going down what you specialize in. All right, so right after the break, we are going to discuss why there is an increased need for mental health services. We'll be right back.
Ernest Hemingway wrote The Old Man and the Sea at 52. Satchel Paige was still dominating batters at 59. Celia Cruz was still winning Grammys at 77. John Wheeler illuminated our ideas of the universe at 70. And Roger Crouch was 56 when he first went into space. Your best is yet to come.
Welcome back. The number of Orange County residents with mental health issues has increased, potentially contributing to the rise of suicide rates, substance abuse, and homelessness. Well, that's kind of frightening. What are we looking at?
Well, we're experiencing here in Orange County what we're experiencing across the country, a growing need and recognition of the importance to have our mental health be as healthy and positive as our physical health. There's a lot of factors that are going on that seem to be contributing. One is we don't have a well-coordinated system of mental health, and that really goes back for decades where there's been more of a focus through hospitals, health plans, the state on our physical health and really reduced resources. And we're recognizing we've got to change. We've got to provide a better system of care. Our rates of mental illness in our county, particularly in youth and seniors, is actually growing at a faster rate per year, and our incidence is higher than the state overall.
Wow.
And so we know that, and so now we really have to find a way to better respond.
I wanted to say that last night I was watching a show with Oprah, and I mentioned to you before we came on that Lady Gaga was on, and she was very open about talking about her mental illness that she had, and she's been treated and she works very closely with her doctors. How easy is it for someone to come to you and say, I have something going on?
It's very easy. In fact, there's multiple ways that patient can access care in our KP system. Some patients who haven't established care in behavioral health, they usually find their way to us through their primary care physician. And what's neat is if they have chronic medical conditions, we also do routine screening to check for PHQ-9, the Patient Health Questionnaire 9, to see if there's any depression there so that we can make sure they get to the therapist or the psychiatrist as needed.
Okay, and that's good because many of our elderly folks do have an awful lot of depression.
Yes.
The other thing that I wanted to talk about is some of them have opioid abuse situation. How do you handle that?
Yes, it's a growing, burgeoning problem here in the United States. And it's really hard for our seniors because as they get older, there are multiple medical conditions, some of which require opiates for their pain control. But as you get older, sometimes your cognitive capacity wanes a little bit, so you're not able to keep track of the number of meds you're taking. Sometimes you double up or you miss a dose. And then on top of that, if you're having sleep issues or anxiety issues, you might add a benzodiazepine such as Valium or Xanax or Klonopin. And then now you've got the mixture of the opiates as well as the benzodiazepines, which is a deadly combination.
Right.
So you're absolutely correct. We are, in Kaiser Permanente, in fact, we're trying to be more proactive about it. We have implemented various ways in which patients who are on high dosage of either, we're getting them slowly weaned off. And doing it in a very proactive way. In fact, some of the opiate work we've done is some of the most innovative in the state of California in terms of what we've done through our emergency departments.
Okay.
And we're sort of adopting the same formula with our benzos and opiates.
So many people will go to their primary physician, and I'm not specifically saying at Kaiser, but many of them across all hospitals will go to their primary physician.
Yes.
And the primary physician will prescribe some of these things that you're saying. So is that not something that they should be doing, and they should be directing them to folks like yourself, or what should they be doing?
No, that's a really good question. I think that's part of where the problem lies, is that patients have legitimate pain issues, they have legitimate conditions, but sometimes if they are not following up with their primary care doctor, if they need a specialist to come into the picture, that's where the primary care's role is essential.
Okay.
As the primary care provider, they get to help quarterback and help the patients figure out just how much opiates do you actually need? Are you responding well to it? Is your condition improving where you don't need that medication any longer? And if you do get into trouble with some of these medications, absolutely, we can simply refer you to a specialist and get you that level of content expertise if that's what you need.
Okay.
But I think that primary care physician role is critical.
Okay, good. Now, another thing that we had mentioned is that there's an increased rate in suicide, homelessness, and a variety of other things. How are you handling that?
Yes, I think as an organization, we have really prided ourselves on looking at behavioral health, looking at mental illness, and getting people to share their words. I think the biggest problem we face in the world and in the United States is people are afraid to talk about it because of the stigma.
Right.
Just like you alluded to Lady Gaga, I'm just
Right.
so grateful when we have celebrities and people who care about mental illness, because our motto is without good mental health, there is no health.
Right.
Right?
Right.
You can be physically healthy, but if you're not mentally well, all is for naught.
Exactly.
And so so we really, really pride ourselves on the fact that we are doing everything possible to eradicate that stigma and getting people to talk and get the care that they need.
And
Excellent.
it really, relates not just to mental health, but our overall health and sort of our securities in life. If I'm stressful, it might put me at risk in maintaining a job. It might put me at risk in terms of caring, for my family. And so we, again, as Dr. Wynn said, need to go upstream to help people deal with stress,
Right.
deal with the challenges of everyday life, because it can lead to some of these things that then affect our mental health.
Well, exactly. And I like the fact that you get in on the ground level with your questionnaire, which is really important.
Right. In fact, I would add to that, Mark, that we've talked a lot about social determinants of care, where when you look at the patient's overall health, only 30 to 35% of it is actually clinically related care. The rest of it is, do they have enough food? Economic challenges that they face, transportation issues. If you don't have the money and you don't have the way to get to your doctors and you don't have food on the table and you don't have a safe place to live, I think talking about various other treatment modalities starts to become a secondary issue.
Exactly.
For many of our patients.
Exactly. And I know that homelessness is one thing that we're certainly dealing with here in Orange County. And both of you have your hands full, I think. Tell me a little bit about, I know we'll be talking about some things later, but
Yes.
tell me a little about sort of what are your feelings about that now?
Well, I'm an optimist. I actually am an optimist in terms of our county addressing. I serve on an executive council with United Way, United to End Homelessness, and our goal is to eliminate it with focus on particular populations. And the reason I'm an optimist is I see there are so many willing partners.
Oh, good.
Our public partners being cities, our apartment owners that want to access their units, for people in need, our faith-based organizations, and obviously all of our caregivers. And so, a lot of it is linking people to the available resources that we have.
Right.
And not have a fragmented system, but to go at it together.
Exactly. And when we come back, we'll talk a little bit about a new facility. So,
Yes.
Thank you. Hang on. All right. So when we return, we are going to discuss a new concept, a first of its kind, a sort of a mental health ecosystem, if you will. Stay with us.
How are you making the most of your life, and do you apply that same devotion to planning your financial future? A train off its tracks goes nowhere. Having a financial plan that is consistent with your lifestyle will keep you on track through your retirement years.
Align Wealth Advisors specializes in creating a financial strategy that best fits your needs and your lifestyle, now and in the future.
Align Wealth Advisors. Live Wealth Balance.
Welcome back. Well, As we mentioned, a mental health ecosystem. Well, that was what Lisa Bartlett called what we're going to discuss now. And Be Well is pretty much what we're talking about. Be Well OC Center, is that correct?
Yeah, you know, about 3 years ago, a handful of people representing public, the Board of Supervisors, the county, faith-based organizations, and our health systems, including Kaiser Permanente, came together and said, are we doing as well as we can in addressing mental health? And there was just an immediate response, no. And so we said, well, are we willing to work together to address it? The answer was quickly yes. We weren't sure what that was going to look like. And really over what's happened over 3 years is we now have a collective of well over 100 entities in our county that are working together on 6 pillars to improve, basically to create a mental health system that is world-class.
Right.
And progress has continued to occur over those 3 years.
Right, and you've broken ground already. Are we opening soon, or what are we looking at?
Well, we broke ground in October on what is the first of what we think will be multiple mental health campuses, our Be Well campuses. And what these campuses are going to do is provide sites where individuals in crisis can be brought to versus our emergency rooms, because we know these will be better sites of care with specialists like Dr. Wynn there to meet the needs, and then to have multiple levels of care, both for substance abuse disease and for mental health crisis, and we know there's a relationship between the two, so that every resident that has that need, their need can be met.
Okay, so now from your perspective, you have a position already, so how will you transfer here? Will you be going back and forth?
Oh, actually, the reason why the collective group and the content expertise of the various groups is so powerful is that we can all bring our expertise into the same pot and grow something that's never been done before.
Right.
And when you look at the way that mental health care delivery is done across the United States, some of our most vulnerable crisis patients are the ones that slip and fall through the cracks.
Okay.
And so I think Be Well OC is a great way for us to strengthen that safety net by bringing all this content expertise, thinking about the workflows, what works well, how do you get people care regardless of payer source? And getting that information together so that that information is shared. If they come from Kaiser Permanente, they come from Hoag, they come from Memorial Care, they can go back to their respective groups with that information, having received care regardless of where they came from originally.
I mean, one of the things that we identified 3 years ago is that our system wasn't as good as it could be because it's fragmented.
Right.
Okay, one provider site, one ER, one doctor doesn't know the care somebody has received elsewhere. So by coming together and finding a way to share information, to coordinate care, fill where there's gaps, all of that is going into creating, again, a world-class mental health system.
So it is a work in progress.
Yes.
It is.
And it's nice to have people, because we all have our areas of expertise and strengths, but to be able to, everybody to bring that to the same team and to think with pie in the sky type of thinking, how do we make something that's never been done that's super innovative?
Yeah.
That's
and Lisa, one of the things that really makes our effort unique is the public entities, the county, CalOptima, working with the private. We really right now have an experiment that the state, the governor's office is watching, is supporting both from a funding and expertise standpoint, because we believe that's part of the key, bringing private, nonprofit, private, public entities together, because we all have a responsibility to make sure our communities, our residents are as healthy as they can be, including mentally.
Exactly. And this is the first of, you said 3. Where would the other 2 be?
Well, the hope is that we have these campuses across our county. So the first one was put right in the middle of the county. South County has needs and needs access, as does the North and the West.
Okay.
And so work is happening on that right now.
All right, excellent, excellent. One thing I wanted to also bring in is our aging population. I mean, I would imagine you see an awful lot of ages from young to old. Are you seeing an increased visitation from elderly population with mental health?
Absolutely. In fact, SAMHSA had published that between 2003 and 2013, the population of those age 65 and older grew by 25%. And they said that 25 years from now, that's going to grow by 50%. So out of a US population of 330 million, you've got over 50 million of those are age 65 and older.
Wow.
And we are seeing that growth for sure in behavioral health. And it's partly what you referred to earlier, where as the older adult patients age, they start to have more medical conditions, have more medications involved. And some of those medications, opiates and benzodiazepines and whatnot, sometimes contribute to the need for more specialized services, such as addiction medicine services or psychiatric issues. And as the patients get older, not only is it the medical issues that come to the fore, but also you're dealing with loss. You're dealing with loss of functionality. Sometimes the transition to retirement is not such a smooth transition, and as it turns out to what they had hoped. And so there's a lot of loss of functioning, both physically and mentally, dealing with the changing cognition over time. And when you have other family members come involved to help provide some of that caregiving, now you've got to think about the stress on the caregiver.
Right.
And so now we are not just taking care of the patient, the identified patient, but we're also taking care of the caregiver who's taking care of the patient.
Yeah.
You know, I mentioned earlier this afternoon that stress, you know, is a factor. And so, you know, as we age, a variety of things can occur. Loneliness.
Right.
Yes.
And Dr. Wynn speaks, and we see it all the time in our sites of care where spouses that are caring for a loved one are in a position that they maybe didn't expect themselves
Exactly.
in. And so again, they've got to stress because they are doing something really important, and they may or may not be equipped to do it.
Well, and to just top that off, not only loneliness and depression, but guilt.
Yes.
Because when that caregiver leaves and if something happens, how do you help that person?
Yes.
I mean, from a guilt perspective, that's got to be tough.
Right.
Absolutely. And how do you navigate that as a family, trying to decide how do we take care of dad or mom?
Yeah.
Between siblings, how do we do this well? And at what point is it no longer safe to take care of dad, mom, in their allowing them to live independently in their home? These are things where our social medicine team can be very, very helpful. And we talked about moving that care upstream so that we're not caught in a crisis later. And I think some of that is our partnerships with the Orange County Alzheimer's Association.
Okay.
And so part of my role is making sure that psychiatry, addiction medicine, neurology, primary care, the ED, everybody's talking to each other and thinking about, what are you guys seeing? How can we best help these patients
Right.
better?
Well, that's good. You're putting patients
But
first.
you know, back to that word collective, you know, because it's so complex, the idea of the collective, be well, is that no entity, even one as integrated like Kaiser Permanente, can do it alone. Yes. We have to connect all the resources in our community. We actually have a responsibility to those we're serving to connect people to the resource that they need, hopefully where it's convenient.
Right, right. I want to go back to something that you had mentioned. People who find themselves having some form of mental health issues, what are some things people can do right off the bat without having to go in to see you or their primary doctor?
That's a great question. In fact, it makes me think about all the different ways that people seek care. They reach out to loved ones, they reach out to family. The isolation and loneliness is not a small part. In fact, we're going to probably find out as a society, social media in some ways has made us feeling more lonely instead of more connected.
Well, yeah.
That's just something that I don't
Hence
think we were...
texting.
Yes. People can sit in a room and not even make eye contact
Right.
and feel alone, right?
Right.
But I think to your question, when you think about how patients access care, it can be a multitude of ways. And what's nice about our integrated system is that if they're in crisis, they could go to the emergency department. If they're established with their primary care doctor during a regular clinic visit, they could seek care through there. And they could also call the appointment line, and they can get triaged appropriately into behavioral health.
Excellent.
There's so many different ways to get in.
Excellent. And some other things that you'd like to mention about Kaiser and how they're handling everything?
Well, you know, I think we're excited about what's going on right now. I mean, technology is allowing us to do things that I think are going to better meet all medical needs. Care is moving to the home. The safest place we can all be is in our home because we know our home. And so the ability to monitor our members at home if they have healthcare needs, the ability to deploy the right resources to the home. Someday we believe what is done today in the hospital will will actually be done in home.
Wow.
And that'll help us with infection rates
Right.
and with falls, and it's just going to be so much better. The other piece that's really changing, is artificial intelligence.
Oh, yes.
And we're going to see personal care. Dr. Wynn and I, let's say we shared the exact same disease. Today we're going to probably get care that looks pretty similar.
Mm-hmm.
In the future, we're probably going to be able to say, Dr. Wynn, it'd be better if we used these medications, and for Mark, it'd be better if we used these.
Mm-hmm.
And so I think we're going to be excited, I think, and impressed with the kind of changes that are still before us.
Excellent. Well, thank you both so much. I really appreciate you taking the time.
Yeah, well, we've enjoyed it.
All right.
Thank you so much for having
You're
us.
welcome. If you'd like more information about what we just discussed, you can always go to kp.org/mental health, or you can go to the Be Well site, which is bewelloc.org. Thank you for joining us, and join us next time as we discover more about your health.